She just gulped and stood there with tears in her eyes and stood up her hand like she was directing traffic. I said, just a minute, wait to talk. She said, I don't think this has happened before. This is your heart. No one else is coming. She's answered prayers. Later that day, or later that week, I found out that there were 2 other people on the transplant list, actually higher priority than me because they were pediatric patients, but they couldn't take a 39-year-old's heart. So I did not have a bunch of other people sitting around deciding who got the heart with me. It was my heart. And I also remember that day, one of my surgeons, an Australian, before they took me back into the surgery room, he announced, sort of shouting down the hallway to my wife, "It's a good heart." He had told us that it's not a go on the operation until he declares it's a good heart, because sometimes the heart muscle begins stiffening up when it's outside the body. So it was just like a real special time when David said, it's a good heart, it's a go. So I had to transplant.
Tell them hope isn't far away. There's new life in Jesus' name. And I'm not ashamed.
All right, welcome to For the Kingdom. Today we have Gary Lethco, Dr. Gary Lethco. How you doing, sir? Goes by Gary, though. So Gary has traveled from quite a distance today. Gary's a 70-year-old man, but he's young at heart. And Gary has a new heart, and that's what we're going to talk about some today. So Gary, first I'm going to just give a basic bio.
Sure.
And then we'll get into your story, okay?
Sounds great.
All right, so you have someone else's heart in your chest, another heart's beating in your chest. You said when the Lord orchestrates a number of miracles, you have an obligation to share your story. So that's a big reason you're here today. So a native of Knoxville, Tennessee, spent most of your life in Tennessee, went to med school in Memphis, residency and family practice. You've taught a lot of residents, hospitalists, been a medical examiner. We're going to talk a lot about this, but your wife, Terry, your high school sweetheart, and you said you married up because she's a prayer warrior.
Correct.
And you really credit her for saving your life.
Absolutely.
And so we'll talk about that. So you've got 2 sons, Adam and David.
Yes.
3 grandchildren. And so today we're going to talk a little bit about DIBS rules. I don't even know what DIBS rules are, but we're going to talk about it.
All right.
And we're going to talk a lot about Joshua 1:9. You know,
Wonderful.
Wonderful verse. Joshua 1:8's wonderful too. But you said this is way overdue. This is way overdue. So, all right. So let's start, Gary, from the beginning. Well, first, before we do that, you know, I give everybody a little gift. Whoops. All right. So I actually had this. You like this right here. I had one of these before we even talked.
Way cool. It's wonderful.
And Gary and I both have Joshua 1:9 on our wrist. That verse was powerful when I deployed. But also I want to give you this, you know, because this is what this is all about here.
Hold it up.
Yeah, that's right.
Beautiful.
So not ashamed of the gospel of Jesus Christ.
16. Thank you so much.
You're welcome, sir. You're welcome, sir.
I'm going to step off camera for just a second to grab something here.
He's going to grab something. I don't know what he's grabbing, but he's got something over here. It's a surprise.
Well, hope it's in here.
Okay.
That
What do we got?
verse that
What do we got over here?
spoke to you, I also
Oh,
wanted to share
awesome,
something
man.
there. Just another little token where you will be reminded of
I
that
love
verse
this.
throughout the day. It's
I
just
love this.
another, I don't usually get men
What is this?
jewelry, but that's a bracelet.
He's giving men jewelry over here.
Usually I give out a little rubber band that says Joshua 1:9 on it.
I love this.
Joshua 1:9 is an all occasion verse. You can use it leading men into battle. You can use it in your own battle to stay alive. I have a friend who even used it as a wedding toast.
I when I first deployed in OIF 1, this verse meant so much to me. And I've actually taught it to my 14-year-old son, you know, because now he's starting to fight some battles, right? We all fight battles. And so this means a lot to me. I absolutely love this.
Oh.
I will figure out how to put it on a little later.
Oh, sure.
But thank you.
My pleasure.
Thank you, Gary.
My pleasure.
Thank you. All right. Well, let's kind of start from the beginning. You are actually, by heart wise, not the oldest guest, but you're 70 years old, family physician by trade. But let's start from the beginning. Where'd you grow up, and what did that look like?
Grew up in Knoxville. I was an East Tennessee native. Spent all of my life in East Tennessee except for the first 3 years of med school. I was really fortunate back then when I trained that you could do a lot of your senior year on other campuses, and I came back to Knoxville, where it was home for me. And I set my sights on family medicine and wanted to practice where I grew up.
And I saw in there your dad owned a grocery store.
Well, he managed
a grocery store.
Yeah. People, you know, I tell people eating Smoky Mountain Market hot dogs put me through school. And actually, I put myself through school for an undergraduate degree, and then a business was very good by the time I got accepted to medical school, and my dad helped me out some.
Selling hot dogs.
Yeah.
A lot of hot dogs.
Yeah. But this was Smoky Mountain Market that during the World's Fair, they expanded. They had numerous locations and franchised. It wasn't my dad's business. He was the manager. There were other investors in it when it became big time. But anyone in Knoxville in the 60s and 70s knew of Smoky Mountain Market.
Really?
Yeah.
What'd you do when you were a kid? What was life kind of like? What were you into?
Well, it was more of an idyllic childhood. I was one of those kids that would go out and play with the friends until the streetlights came on and come back home. We'd ride our bicycles 5 miles away to go fishing. There was a family down the street, a few boys. I guess we were sort of rowdy at times. We'd go out and do things, but it was a great childhood.
Yeah.
I wasn't in church. That was probably the biggest drawback I had. My dad worked 6 days a week, and Saturday was his day off. My wife was in church anytime the doors were open, she tells me. But I was just there on special occasions. And when you visit the church just on special occasions, our fellow Christians sometimes don't do a great job of making you feel welcome.
Yeah.
I didn't feel so welcome then, and maybe have some regrets about that. I could have not been playing catch up so much, because after I got this second chance in life, I realized how far behind I was in my thirst for biblical knowledge and the study of righteousness. And yeah, I had some regrets there.
When did you meet your wife? He feels good today.
Sorry. That's James Memmer.
It's all right. It's all right.
Silence that, baby. That was my wife texting me.
At least she's checking on you, right?
Right. So I met my wife. Actually, we started dating when I was a senior in high school.
Okay.
But I met her when she was 2 and I was 3. Knoxville's like a small town, and my aunt actually babysit her and had us together, babysitting at times. And I didn't remember it, but when I started dating, she kept reminding me I should go date Terry. And once we started dating, Terry remembered that there was this girl that played an accordion. It was my sister. We couldn't afford a piano. Accordion was something my sister learned to play. She was 7 years older than me. I thought, that's weird that at that age she would remember that. But she did. And then we started dating in high school and throughout college, and we married 14 days before I started med school.
Did you and Terry hit off right away?
Oh, yeah.
You did?
Yeah, I knew she was the one.
How about, did she know you were the one, though?
Yeah, I think so.
She did, too?
Yeah.
So why did you decide to get married 14 days before med school?
Well, it was a timing thing. Back then, I didn't want to marry till I knew for sure what I was going to do. And getting into med school was and still is quite a challenge. You can do everything right and still not be the lucky one that makes it in. As you know, with PA school, the same thing. And I wasn't sure I wanted to marry not knowing what my future was.
That's probably smart, right?
Once I got accepted, then we set the date.
Yeah. When did you know you wanted to be a doctor?
Oh, in grade school.
Really?
Yeah. My mother suffered with a lot of medical problems. When I was probably 9 or 10 years old is when she had significant congestive heart failure. It was a viral thing, myocarditis. And I was one of her caregivers. Dad worked 12 hours a day, and my sister had just moved out. She'd got married at a young age and had a child. And so it was me and Mom at home and Dad working. And so, yeah, I helped take care of her.
So you knew from a young age. That's pretty crazy. All right. So you go to med school and everything works fine. No issues. Your wife stays with you and you're working a lot of hours. And are you enjoying the work?
Oh, yes. Med school was a wonderful experience. I didn't like Memphis. Being in East Tennessee, and it's like a different world. It was a great experience to learn, though. A big medical center. Obstetrics, which I decided not to do, was something very interesting and challenging as a student. And the unusual thing is that back in that era, the medical school hospitals couldn't function without the free labor of the medical students to help them.
They couldn't function.
Like when the medical center, they didn't have enough folks to do the EKGs and chest X-rays and transport patients. The medical school students were sort of free labor to do that, and you were part of taking care of everything. And when we had breaks from medical school, we could go back as externs. If you made a good grade and got a letter from the chairman of the department, you could go work OB and deliver babies. And back in the late 70s, I delivered babies for $5 an hour.
$5 an hour.
Yeah. So that's some money for med school. Yeah.
That's probably not even that good of money back then, was it?
Well, back when minimum wage was $1.75 or $2, I guess it was pretty good.
I was talking with my medical director about why is it so hard to get people to go into OBGYN. He said the liability.
Oh, yeah.
And the stress and the call and there's a lot of emergencies. You get sentinel events with mom or baby, and so it's hard work.
Well, it's an attitudinal and cultural thing too. It's probably starting in the maybe 70s was when I think the whole culture decided that if something goes wrong during pregnancy, it's the doctor's fault, and he got to pay for that. What went wrong?
Yeah.
And that notion is what drove up malpractice and changed the practice of medicine, especially there.
Well, and things just go wrong sometimes.
Yeah.
All right. So went to med school. You graduate. I guess you're in your late 20s when you get out of school, and
I went sort of straight through. I was 25.
okay,
Yeah.
and then you get out and practice medicine, and
I was 28 or 29 when I finished residency. Yeah.
okay, and fairly uneventful.
Well, a lot of things going on then. Let's see. I was in residency during the time of the World's Fair, and I enjoyed the golden age of residency. Residents could do most anything back then. We didn't have much supervision, not like it's required now. Now, everything a resident does has to be observed, or especially in surgery, done with the attending on site doing it all and documenting like crazy. It wasn't like that back then. And I happened to train at a time when family medicine was extremely important at this hospital I was in, because the pediatric program had just left and the surgery program was struggling a little bit. And so the family practice medicine residents did everything to the level of the other programs. So it was a great experience learning then. And helicopter medicine was just coming to Knoxville. I personally knew the founder of the Lifestar program that started the helicopter program at UT. And during the World's Fair, they stationed a Tennessee Highway Patrol helicopter there, a reconditioned Huey from Vietnam, and started training folks for these flights. And really, this kind of stuff would happen. A resident came into the office, a senior resident, said, "Hey, Gary, what are you doing this afternoon?" I said, "Well, I just got one patient right now." He said, "Well, see if somebody else will see him. Fly with me up to La Follette and let's get my patient who had a heart attack." And we hopped on the helicopter and flew up and got him. And you just think that's something out of the storybooks.
Yeah,
that really happened during my training.
that's good training though.
Yeah. Oh, it was amazing. The other things in that training were just really crazy. I decided my senior year of residency that I wanted to develop some better surgical skills, and I talked with a faculty surgeon I knew fairly well, whether I could do an elective with him. He said, "Sure, we'll do that. I'll teach you some skills you can use in your office." And I thought, well, okay, I'll have this rotation where half a day I spend it with my patients in my office. That's what they did in family medicine, half a day in your office, half a day with some subspecialist. So that's half a day I was with them doing surgery. We did a little bit of surgery and did a whole lot of playing medical examiner and being on the firing range, because he was a gun nut. And he was also a medical examiner for Knox County. And after I finished that rotation, I got paged to his office, and he said, "Hey, I need you over here this afternoon. Can you stop by?" And I did. And he told me, "Raise your right hand. I want to swear you in as assistant medical examiner." I said, but. And he said, "I've already talked to the chief, your chairman. Okay, is it?" I said, "But I'm just a resident." He said, "It's okay. All you have to be is a licensed physician." He said, "Okay, what do you want me to do?" He said, "I want you to cover this weekend. I'm going out of town. You're on medical examiner call." And he said, "But," I said, "I don't feel equipped. I've trained for a few weeks now." He said, "Well, if you don't know what to do, call Bob Lash. He's been doing it since you and I were in diapers, and he's available on the radio. But they're dead. You can read about it and get it right. And if it's a complicated case, those are the ones you're going to get an autopsy on anyway." So it was sort of on-the-job training, and I started doing that as a senior resident.
So just for the audience, when you're a medical examiner, you're evaluating patients that have passed away.
Every death that occurred in Knox County, unless it was known to be a natural death, they had to call the medical examiner before they could move the body. So, yeah, it was a big deal. You got calls throughout the night.
Yeah.
Usually from a policeman investigating the death to see whether it was natural or not. It was an unusual experience as a resident to do that.
When I was in PA school, we had a pathologist who did he did a lot of he was a medical examiner, of course, in the military, and PA students would come, and it was tough for me, to be honest with you. I didn't want to see the faces, and because I start to think this is the person behind this is somebody's dad, and this is
when you personalize it, it's rough.
Yeah.
And I guess you can say I can be a scientist, and I can depersonalize it to do this job, and I have a strong stomach, so I can do most things. Some of the deaths are pretty gruesome. They were a challenge, especially when I was just in my 20s. Yeah.
All right, so let's fast forward after the 20s. When did you have your first kid? When did you have your son?
I was 31, I guess.
Okay,
yeah.
31. Mm-hmm. And so really what we're going to really talk about today, though, and you tell me if you want to get into that next, is why you have a new heart now. And to be honest, Gary, I never knew. I mean, I'm a medical provider, but I have really zero experience with this. I had no idea what it's like to face the reality that, like, every day you may be gone. And so when you were telling me your story, I was just picturing what it'd be like to, like, face possible death. And I'm sure it was like this for you. It's just got to be hard. So you want to get into that, or you want?
Sure,
Okay.
I'm glad to. Beginning with the heart attack.
Yeah, let's just start. Well, maybe let's start with the first one.
Okay. First one, I was 38.
Which is young.
I had a tobacco addiction. I had a family history. A high stress job. I thought I had indigestion. I had some substernal pain that wouldn't go away. I knew it couldn't be my heart.
Why'd you know it couldn't be your heart?
Well, I was being facetious because I was too young.
Yeah.
And when I had this pain, I carried my 2-year-old youngest son in one arm and an umbrella in the other, and walked up and down their street in the rain one night when our neighbor's alarm was going off. I said, there's no way I could have done that if I was having a heart attack, because I was having the pain at the time. Mm-hmm. And I thought, that's just bad indigestion. And then about 4 a.m, I woke up in a sweat and knew something wasn't quite right, and went on in to see my cardiologist. Well, I saw my family doc at 7 that morning, and he got me into the cardiologist the same day. And he said, you've had an inferior MI over the weekend. They did a study and said there was very little damage or very little reversible damage. So I just lived with it, but I knew I had heart disease.
And did you quit smoking after that?
No.
You didn't?
No, it was sort of part of being a driven person, that just like you drank coffee so much and training, the smoking was part of it way back then too.
A different time.
Yeah, a different timing. And it was, if you're up in the middle of the night going to the emergency room, having a smoke was necessary to get your motor going.
Yeah.
And back then, an awful lot of healthcare providers smoked. Doctors did it privately. Huge numbers of nurses smoked.
Yeah.
It wasn't something we were proud of, that addiction, but it related me to the common man. When I was a resident at the hospital, I had probably the majority of the housekeeping crew and a lot of other folks at the hospital were my patients, because they said, hey, I'm going to see that doctor that smokes. I met in the smoking area,
Yeah, you related to them.
I related well, yeah.
Well, after a stressful day or stressful patient, you'll go on the back and smoke a cigarette, and everybody complains a little bit, and you kind of relax and decompress. I get that.
Yeah.
So 38 when you had the first heart attack. Mm-hmm. And then fast forward, when was your next one?
It was 2 days after my 55th birthday.
just want to back up a little
Yeah.
bit. So I know you told me your wife was the type of person like going to church every day. Just what did that look like before this heart attack? I mean,
Oh,
were
okay.
y'all?
We were active at
Yeah.
our church. We attended and belonged to a downtown church that drew people from all over town. We really liked that our kids had another group of friends from the church that were different from their Boy Scout friends and their soccer playing friends and their school friends. That was an active decision that we chose a downtown church, and it was one of the churches you could go to learn during all the sermons.
Was because one of the things we talk about a lot is that there's a difference between believing in Jesus
Mhm.
and following and obeying him. There's a difference. So I would say in America, a lot of individuals believe in him, but they're not following him. At that time, before you had this heart attack, were you just believing in Jesus, or do you think you were following him too?
I was believing and following. I knew he was the way. I wasn't changing my life. There's something called sanctification.
Yeah.
You're becoming more like Christ. And each little bit you get a little better being like Christ. Sometimes not the major changes where you accept him as your Lord and Savior and make changes 180 degrees. You make little improvements. And I guess I was there. I was a good person. I believed in him. I prayed to him. It wasn't constant throughout the day like it is now. Thanked him for I blessed the food and raised my kids blessing the food. The kids were active in the church, pretty active, not as much as my wife was. When she was raised, she was in the church anytime the doors were open. We had competition. We had scouts and soccer and other things that took some of our weekends. We weren't quite as involved in the church then. And as our kids got more serious about it, they got more involved in the church later. We did too.
So I guess it'd be safe to say that after this, you said 55?
Mm-hmm.
55, when you had this next heart attack, that since this experience, you have moved to a new level of intimacy.
Oh, absolutely.
With Christ.
Absolutely. I might have been quietly Christian, and now I'm bold about it. Yeah, bold about my faith and what Lord and Savior Jesus Christ means to me.
Well, in Acts it says, "But you will receive power when the Holy Spirit comes upon you."
Yes.
And so let's just talk about what happened that day, and let's walk through that.
Okay. Well, I had the Holy Spirit then.
Okay.
Okay. When you receive the Holy Spirit, is the way I understand it, you get all the Holy Spirit you're going to get at that time. It's just how much of you are you willing to give up to the Holy Spirit?
Yeah, that's good.
And he's claiming more and more as time goes on. So he had a modern part of me by then. But I had quite a journey near death with a lot of praying on my part, a tremendous amount by my church, and my wife was nonstop. And that's why I came through the journey with my heart.
So you were leaving work that day,
mm-hmm.
and you were driving home, and what kind of happened?
Okay. I was leaving work and experienced the worst pain imaginable. The word some people use for such pain is excruciating. Ex meaning out of, Latin, crux, C-R-U-X, cross. So compared to the crucifixion, severe pain. And the other big descriptors for that I hardly ever use are profuse diaphoresis. That means lots of sweating. I was sweating so much I could hardly see, just sweat running down. And when you have pain that severe, it's so intense, you know you can't stand it long. You're either going to pass out or die. You know that this is the end of your life on earth.
You knew that
I
then.
knew it, absolutely. And I was driving home from my office, which was 15 or 20 minutes away from my house, and UT hospital is the same distance. There's a point where we have to go one way or the other to go to UT versus go home. I was afraid to pull over because I didn't want to die by myself. So I prayed for the Lord to keep me alive and get me home to my wife. And well, he did, and I made it there. And I passed out in her arms with her praying with an intensity I just never seen since. I came back to briefly as the ambulance was taking me to the hospital. Then it was 3 days later before I had any other memory of what was going on when I woke up, and there was something in my leg and I was restrained where I couldn't move. And I found out there was a intra-aortic balloon pump in my groin with this pump doing the work of my heart because my heart wasn't working so well. And when I found out that it was 3 days after my heart attack and I still had a pump in my body, I knew that was a pretty ominous sign.
So when you were driving home, I think at one point you told me you were about halfway between going back to work and going back home, and you absolutely knew this was the end.
Oh yeah.
And I think you told me that you just wanted to make sure you saw your wife one last time.
Yeah, that was it. That's why I wanted to go home, because I knew I was dying. I just prayed for the Lord to get me home to see her one more time before I left. And he did, and gave me a second chance.
So when you woke up 3 days later, so this pump is in your leg?
It goes right in the groin.
Right in the groin?
It's a big conduit that goes in, and the pump is actually in the intra-aortic balloon pump is what it's called. So every time your heart beats, this pump expands and sort of augments the flow of the blood.
Okay.
So if you have a heart that's very weak, you can augment every pump so that you get good blood flow to the brain, the kidneys, other vital organs.
So when you were driving in your car, was that the Widowmaker right then?
Yeah.
That was the Widowmaker,
Yeah.
which left anterior descending artery.
Mm-hmm.
And it supplies 50% of the heart's blood. And
Pretty much the whole front wall
yes.
of the heart is supplied by the LAD. Right.
When you woke up 3 days later, do you remember any of those 3 days at all?
No.
No, none of it.
No.
So what hospital were you at?
At UT in Knoxville.
UT Knoxville.
Mm-hmm.
And number one, and you wrote this a little bit, but medical providers are the worst patients.
Oh, absolutely.
And you were, I think. And so 3 days later, you wake up, you have this pump, and they tell you had a Widowmaker heart attack. And how much damage of your heart do you think you had? Did they tell you all that stuff then, or?
Sometime during that, numbers leaked that my ejection fraction was in the 20s.
The 20s.
It wasn't a sit-down visit. This is what we think is going on with your heart. But I'd personally had patients who'd had major heart attacks with ejection fractions in the 20s, and found out that the heart muscle was stunned, just like if you go up and cork somebody right in the shoulder and it's in spasm and doesn't want to work for a while. Well, imagine this heart muscle was injured, and it was not totally injured, just shocked from it. So it's a weak pump for a few days, and it may recover in the next week or two to be much better than that. That's what we hope. And I asked my cardiologist if he thought mine might just be stunned, and he said, well, let's hope, but I don't think so.
Yeah.
And when I was talking ejection fractions, if you
Yeah, explain
this,
what ejection
if this was
fracture is.
a rubber cup and I could squeeze out 100% of it, that ejection fraction would be 100%.
Okay.
If I can squeeze out 60-something% of what's in there, that's what a normal heart is doing when it's pumping well. 60% of the blood that gets in there is pumped out, and that's a good cardiac output. When it gets down in the 30s is when you have significant symptoms of heart failure. 20s, you really got some symptoms. And in my case, I was in the low 20s and it didn't get better.
What's the least that a person can live with?
Well, when you get into the teens, you need something to help your heart pump. This is fast forwarding a long ways off, but when I was in Birmingham at UAB awaiting a transplant, I was getting something called an LVAD first, a left ventricular assist device. This is a pump that's permanently implanted inside your body to do the work of your heart. And before they put that in, they needed to measure my ejection fraction. So they weaned me off these IV drugs.
Let's just back up a little bit. So, because we'll get into that. So
Okay.
I just want to make sure we don't miss some stuff. So at the 3-day mark, they come in, they're like, hey, your ejection fracture's in the 20s.
Yeah.
You got this pump. And then what happens? How long are you there? And
Okay. So they said we're going to have to get that out in the next couple of days because it's going to damage your artery.
The pump is?
Yeah, they can't leave it in there long.
Okay.
And so they weaned me from that, giving me some IV drugs to keep me going. And I'm in the hospital for, I don't remember exactly how many days. And went home on the usual recipe of medicines that cardiac patients are on. And no smoking. Yeah, I made it easier to quit smoking. And I saw my life was forever different. And I had recurring pleural effusions, fluid collecting in my lungs. And got rehospitalized a number of times. And one hospitalization, they drew fluid off my lungs 4 times. Each time it was a whole liter. And
so they took the pump out, and you were still hanging out in UT, going back and forth in and out of the hospital. Or you were staying there the whole time?
No, I got to go home.
Okay, so you got to go home.
I live a couple miles from the hospital. And then I was rehospitalized a couple times that fall with recurring pleural effusions. And my cardiologist said, I don't think it's your heart. Even though you got heart failure, I don't think that's where all this fluid's coming from. He's a very astute guy. Called in the pulmonologist, and they drew fluid off my lungs numerous times and always gave me great relief. And he fine-tuned the medicines to get the best effect. And they said, you've got something called Dressler's syndrome. This is a sort of common condition after you have heart surgery where the sac that the heart is contained in gets inflamed and fills with fluid, and it causes pericarditis. Well, the same kind of inflammation just from the injury of a big heart attack caused the pleura, the covering of the lungs, to make all this extra fluid. And so I was having recurring pleural effusions from this inflammatory reaction. And they did, all these thoracentesis, and we're waiting on tests. And finally,
so describe the thoracentesis. What's that? They go in there with the big needle, right?
Yeah.
And pull fluid off.
Yeah. And the first few times they did it real carefully with their ultrasound and marking it. And after a while, they know where it is. And just
is it painful?
When they stick it in, it is.
Yeah.
Yeah. That they try to numb you, but you feel it. And then when they I guess it was validating when I was pretty anxious by that time with the trouble breathing. And I said, I know I've got a lot of fluid in my lungs. And they said, well, you show you the x-ray, it doesn't look like much. Well, just on a straight on view of the lungs, it may not look like it's filling up the lungs.
Till you lay down.
Yeah. And when it sort of validated when they pull off a full liter of fluid each time, and then I felt great. But I said, what's going on? Why can't we fix this? A surgery friend of mine said, well, we can put a little thing in there like a stopcock to let the fluid off and not have to stick you each time, but we got to know what's causing it. They did all these other tests looking for leukemias and things that can cause fluid in the lungs. And my cardiologist did a right heart cath to measure the numbers, and the right heart wasn't showing that much failure at the time. And so they said, well, this is Dressler syndrome. We treat this with high-dose steroids. So if you've ever used steroids, you know that steroids cause fluid retention in high doses.
Yeah.
So, but they're going to give me high doses of steroids to treat this inflammation in my lungs to help my heart. And so I went home on high-dose steroids, and a couple weeks later, in fact, I was at a state soccer tournament when I crashed and just got all smothery and filled up with fluid again from the steroids. Saw my cardiologist, and he said, we got to taper you pretty quick. This is not working out. He tapered me from the steroids, and my heart function was getting pretty low by then. I had another hospitalization the Thanksgiving week. The electrophysiologist in that group, the one who does fancy things like pacemakers and defibrillators and stuff, I had known since residency. And I met the criteria for a defibrillator and something called cardiac resynchronization. That's where they change the timing of how your heart pumps with electrical impulse change. We've got a built-in mechanism for their electrical activity to go from the top chamber to the bottom chamber and pump efficiently. But when you got muscle damage, it's not so efficient. So they put a 2 ventricular pacer wires in and control that, and it makes your heart a little bit more efficient and gives it more kick. End result is I got a little bit more pumping out of this heart that was so damaged.
So this is an implantable device. It's a surgical procedure.
Yeah,
they put in there.
Just like having a pacemaker on it. It also had the defibrillator, so if I went into a threatening rhythm, it could shock me too.
You know, one of
he did that on Thanksgiving.
Yeah.
It was amazing.
So you wrote on here also, you said one of your cardiologists, they gave you this piece of paper.
Oh, yeah.
Was it this cardiologist that you're talking about?
No, my cardiologist that took care of me through all of it, Dr. Scott, dear friend, he's the one who sat down on my bedside one day and said, you may find this comforting, and handed me a slip of paper. At first I thought it was a prescription, but you don't hand out prescriptions in the middle of the hospital stay. And I opened it up, and he had written Jesus Calling by Sarah Young. And
I bought a copy.
Yeah.
I actually think I had another copy of this. It's a pretty famous book.
It is. This Sarah Young is very gifted, and she writes a devotional that has a detailed discussion each day based upon a couple scriptures. And each day is like Jesus talking to you, Jesus calling. And it was amazing, downright uncanny, how each day that was comforting with things that seemed specific to what was happening to me. And it sustained us.
And did he give this to you? This is after the soccer incident.
It was right about that time.
Okay.
Yeah.
So now you have this implantable device, and then what happens next?
Okay.
Heart's still not doing well, though.
Doing poorly.
It's not doing well.
I'm just fine-tuning things, trying to figure out how to live with such a bad heart. That includes basically eating a completely different diet with very little salt, taking big doses of diuretic to get the fluid out of your system, taking medicines to help the heart pumping better, to pump a little better. There's only so much you could do with pills. And I was living like that. And on these medicines to ease the work of my heart, I was running around with a blood pressure in the high 80s. If I stand up quick, I'd almost pass out.
That's very low.
Yeah.
I mean, super low.
Yeah.
Now, during this time, were you drawing closer to the Lord during this time?
Yes. Oh, yes. I thought I was going to be seeing him real soon. I knew I was on my deathbed. I talked with him like, "Hey, I'm real close. What do you got planned for me now?" Back then, I was so weak that on the days that say I've got to get up and take a bath, and I would just get exhausted giving myself a bath. So that I got up and gave myself a bath. Said, "Okay, I'll go downstairs a little while and have something to eat." And many times my wife would bring food up to me.
You're just so weak.
It's uncanny how weak you can be when your heart is not pumping the way it should.
And what was you and your wife's like prayer life? What did it look like then?
It was growing by leaps and bounds. It started growing tremendously during the last hospitalization at UT. I was hospitalized. My heart attack occurred in September. I had a number of hospitalizations. Then during the holidays, I couldn't really do anything. My wife took me down the street to a friend's house during the holidays once, and all I could do was say hi to folks and go home. And friends later said, I thought you were dying that day when they recalled how I looked. That's sort of ashen. But I was getting weaker and weaker, and so my wife took me back to the hospital. January 2nd, I was hospitalized directly to coronary care unit. And my friend and cardiologist basically said, "There's nothing more we can do for you here." Well, that's what we heard. He said, "I want to send you to an advanced heart failure center." And he, eventually better explained that, saying, "You're the sickest person we've got here in this hospital. Down at UAB, they've got a whole bunch of people as sick as you. They're much better at it. And they're better at using medicines to help that, because so many of the medicines we use for very sick folks are double-edged swords. They can improve how the heart's pumping, but they may have a real high risk of causing serious arrhythmias. And if you don't use them all the time, you're a little bit leery of using these risky drugs like milrinone." And anyway, he said, "We need to send you to a place that does this." And I said, I was ready to die. I accepted Jesus as my Lord and Savior, and I knew where I was going, and I really didn't want to go on that journey, especially the heart transplant. I knew a little bit about that. I'd had a couple patients with transplants and knew what their life was like afterwards. I didn't see them in their prime. I saw them many years later when they were just having consequences of all the immunosuppressive drugs. But I really didn't want to do that. But
You're still a pretty young man, though.
Yeah, I was
you're
in my 50s.
Yeah, I mean, you're 55 years old. What does UAB stand for?
University of Alabama.
Okay, so you're going to go from Tennessee to Alabama.
This is Birmingham, not Tuscaloosa.
Yeah.
Not the Crimson.
And you were kind of, though, you were like, I'm ready to be done.
Yeah.
And did you tell your wife that?
Yeah.
What did she say?
She said, "We're not ready for you to die."
What about your boys?
They didn't want me to die either. But I never really had a discussion with them much about it at the time. They knew how sick I was. My oldest son by then was last year of college. My youngest son was in his last year of high school. And that was a really rough time for him, especially my youngest, because I ended up being in Birmingham for a whole lot of that year. When I told him that let me pause just a second. When I told my cardiologist I was ready to die, he said, please, let's come up with a plan. I know where you need to go. Let me make that decision. You just got to decide if you're willing to do it. And that led to him coming back the next day and saying, I've got you an appointment with a specialist at UAB next week. We just need to tune you up and get you down there. And I said, okay, we'll see about that. My wife and I prayed about it. We really couldn't get our head around this idea of going 4 hours away and being treated in some other medical center where I knew everybody where I was. And we prayed long and hard about it. In fact, I fell asleep with her and the nurse praying together. They're in coronary care that night, and I woke up and they were still praying many times. And the next morning we had a new nurse, her first day on the job.
First day on the job.
First day on the job at UT, but she spent a previous career at a transplant center. How about that for God's coincidence?
That's rule number one, though, right?
Yeah.
No
coincidences. There are no
coincidences.
coincidences. So she told my wife and I all about transplant centers and LVADs and stuff like that. LVADs are left ventricular assist device, those implantable pumps. And, this was Hebrews 13:2, an angel unawares, just no doubt about it. And
So you think this nurse was an angel?
Yeah. I think there are true angels in heaven that we read about that have different physical appearance than people. But I do think that there are folks who show up on earth that function as angels. I don't know if they were another Christian who was called in to answer a call and do something above and beyond, or whether they're an angel that transformed into a human at the time. But there are...
Well, the Bible says we may entertain angels.
Entertain angels unaware.
And there's multiple examples where, people saw other people and they were angels, though, in the Bible. They looked like people.
Yeah.
And so you woke up a few times at night very weak, and your wife and this angel were actually praying together over you.
Yes, many times.
And it was her first day on the job, and she knew everything about heart transplants.
That's
or a lot.
Yeah. And that started the change. I was beginning to accept, well, maybe I want to try that.
Because, of course, you had to consent to this.
Yeah,
This
sure.
was a big thing,
It's a big deal.
patient consent.
And then my cardiologist comes back and says, you may not get any better than this. I said, what do you mean? He said, I'm thinking we need to send you down right now because we won't have you more tuned up next week. In fact, you'll probably get worse if we don't do something.
So he was pretty worried.
Yeah.
You were getting worse really quickly.
Mm-hmm.
He thought if a decision wasn't made soon.
And he said, I've made a call and they can take you tonight. Are you willing to go? And I said, Terry and I talked about it. I said, yeah, we prayed. I said, let's do it. He said, can we get an ambulance over here and send you down there? And I said, well, I can arrange that, because by then I was a medical director of an ambulance service. So I called up the owner of the company and said, you think you can
coordinating your own care here,
yeah.
Right?
Yeah. And he said, well, Doc, it's going to take me about 20 minutes to free up an ambulance for the next 8 hours. I said, 8 hours? He said, well, they can't, they've got to take you down and come back. That's going to take a while. I said, oh, yeah, okay. And so I was getting ready to go.
How long a drive is that? Like
it's
4 hour
drive.
4 hour
for a
drive.
car. Yeah. Ambulance.
A little faster.
Sirens, a little bit faster. So anyway, I was getting ready to be transferred on the gurney to go down for this trip to Birmingham. And a dear friend of mine showed up. I said, how'd you get in here? He said, well, I think they thought I was your preacher. They just sort of motioned me on back by. And he opened my hands and put a piece of paper in there and closed it back up. And he said, keep this with you and claim it. That was Joshua 1:9 he had written on a script paper. Got in the ambulance. We made it lickety-split. Code, license sirens, all that. We stopped in Chattanooga. I talked them into pulling off to get me some food because I didn't know when I'd have real food again. And we pulled off to the Wendy's in Chattanooga to get a baked potato. They cut off the sirens, still had the lights going in the drive-through lane. It was pretty cool.
You're in the drive-through ordering a baked potato.
In an ambulance.
In an ambulance.
Yeah. And then I got the baked potato and ate it without any salt, just pepper. And next thing I knew, they got me into heart transplant ICU in Birmingham. They started central lines, put me on the super duper drugs. The next morning, I looked at the nurses, and the same folks were there taking care of me. And I said, y'all work some kind of weird shifts here. She said, well, no, hadn't you heard? There was an ice storm that hit all of northern Alabama and Tennessee, and nobody's going anywhere. If you hadn't got here last night, we don't know when you really arrived. Joshua 1:9 and rule number 1, all right there.
Yeah, so
they ended up working 2 full days without getting to go home.
I mean, that nurse who convinced you, that cardiologist who knew this is it. He knew you have to go today.
Yeah.
Your wife's prayers, you were convinced too you had to go. And so the timing was perfect. Any delay and you wouldn't be sitting here right now.
I have no doubt. Yeah. But that wasn't the end of it. Because of what they did there with these specialized medicines, they tuned me up and then weaned me off these drugs and put me back on pills and said, you're ready to go home for a while, but you need to get ready to get an LVAD. I said, oh, good, I'm going home. I don't know if I'll see you anymore. And so I was still not convinced to continue on that journey. I was happy to be tuned up and breathing again. And
so they got you better
Yeah.
on medicine. They sent you home from UAB. Back to what, Knoxville? You go back to Knoxville?
All the way back to Knoxville. And I had an appointment in, I think, 2 weeks. And they said, we're going to do some other tests to really check out your cardiac capacity next time. And I went down for the follow-up visit and failed every test. And they said, you have to consider the LVAD. And I said, I'm not sure I want to do that. I learned a little bit more about it. I didn't like the idea of being battery operated. With the LVAD, you have this pump implanted.
What does LVAD stand for?
Left ventricular assist device. It's a pump that's sort of a rotary motor, so it's a constant movement. It's not the model I had didn't even pulse, so I was pulseless when I had it. But it's implanted in below your diaphragm, and some conduit goes up to your heart into the aorta, so that basically this pump takes the blood that's coming in to your heart and pumps it to the aorta, so the heart's weak pump is not a factor anymore. This little pump's in the work your heart should. And it comes out in a looks like a coaxial cable. It comes right out through the belly to a little control panel. It looks like a computer, about the size of a rodeo belt buckle, and 2 big batteries that attach to it. And so you're battery operated. You can take the batteries off and plug it into a module at the bedside.
So you were having to wear this, and you have to
24/7.
recharge the batteries, and
That's almost comical. The batteries you get initially are just traditional batteries that run out in 4 hours, so you're changing them constantly. But after 2 weeks, the insurance companies decide that you may make it, and they'll pay for the lithium batteries.
now what kind of battery? Is it like double A's?
Well, no, they're big battery
huge
packs.
batteries.
They look like a brick.
Okay.
And you have a vest that holds them so that you can put up with it. And so when you get that pump, it's you look almost like a Unabomber or something. You know, you have this device with two big bricks on it, and I would think somebody's a suicide bomber. I know that is not something to take lightly in your
Yeah.
case, but it was a crazy looking
Yeah, this thing's
thing.
got some real weight to it.
Quite a bit. So that's what I was facing, and they said, this is our only real choice. You need to do this. So I told them that I needed to pray about it. Well, this was the sort of deciding moment. I can remember it like yesterday. The head of the cardiology team hadn't learned the rules everybody else in medicine has. We always wear comfortable shoes. And she wore these shoes with hollow heels that sounded like a half a coconut, clop, clop, clop. You could hear her get off the elevator and walk everywhere, the whole heart transplant ICU. And this was a giant unit. 1/20th of a mile was the distance to walk around the corridors in that one unit. Because in your recovery phase, they had you walk those corridors to show you were stronger, and you could
After you have the LVAD system, okay?
So anyway, I heard her walking in and clippity cloppity clop and come to my room. She opened the door and came in and positioned herself at the foot of the bed. And then the rest of the team came in, and the team represented numerous nationalities and quite a few religions, I'm sure. And
this is a teaching moment for this physician, right?
Yeah.
She brings everybody in, talk about your case.
She had probably 15 people in the room with her. And she crossed her arms and looked at me, and I knew it was sort of some sort of confrontation. She said, "Dr. Lethco, have you finally decided whether you're going to consent to the LVAD?" And I had never talked with that many folks before about personal stuff, and so I just said her name. It took me a while to clear my throat, take off the oxygen, and said, my wife and I have prayed about this a lot, and have you ever watched the TV or the movie It's a Wonderful Life? She said, yeah. And it was one of her favorite Christmas movies. And I said, well, like George said, I want to live again. And everybody agreed and applauded. She said, fine, I've got you set up for the surgery next week. So she knew I was going to do it, and she already blocked out time for it. And so I just had to have those things done to clear you for a transplant. Back then, they wouldn't do the LVAD as a bridge to transplant unless you were a transplantable candidate. That meant basically that you didn't have any infection or cancer. They wouldn't transplant you with that. So I had to have my teeth scanned to look for infection. I'd had tons of bridge work and root canals and stuff, and during the almost 6 months up till that time, when my health was so poor, my teeth were just crumbling and bridges coming out and stuff. So I had 26 things that needed to come out, either pieces of teeth or bridges and stuff. And so I had to have a dental surgery that Monday night under local, because they couldn't put me to sleep because of my weak heart.
But this was pretty extensive. I mean,
26
different stuff. So
they pulled out everything that was in my mouth, so they're going to give me dentures later. So I had all my teeth pulled on a Monday night and had the surgery on Thursday, the LVAD surgery.
But the LVAD is not the transplant yet.
No,
that's not. So this is just step one.
Yeah, to me, it was a bridge to transplant. There are some folks who get an LVAD and say, this is enough. I can live with this. I couldn't imagine living with it at age 55. But if you don't have an LVAD at the right time and your heart's failing, the poor blood flow to your liver and kidneys can throw you into organ failure and you never have a chance.
So you had the LVAD surgery done.
Mm-hmm.
How long between the LVAD surgery and then ultimately the transplant?
Well, the plan was to give me an LVAD and give me 3 to 6 months or maybe longer to get a transplant because they need to build you back up so you're a better surgical candidate.
Yeah.
Uh,
Where was the LVAD surgery done at?
they're at UAB.
So that was at UAB.
Mhm.
And okay, so yeah, so they try to get you stronger because if you're not strong enough, you're not gonna take the heart.
Right, right. Well, about, I guess, a week and a half after my LVAD, I had improved enough to be transferred up from the surgical ICU to the heart transplant ICU. And nurses came running the room with a code card. And I looked and said, "What's going on?" They said, "That's you." And turned around. I looked and I was in VTAC. They said, "You feel okay?" And I said, "Yeah." And they checked my blood pressure and had me lay down and sit up, and it went away and it come back. They never shocked me. And they said, "This isn't good." And
You can't live with VTAC.
no, you can't live with VTAC.
No, ventricular tachycardia.
And they readjusted my defibrillator to where it wouldn't shock me right away because the pump was keeping me alive, but my heart was just in tachycardia. And my surgeon came up and said, "Well, we've got this CT scan and it shows what's going on. This conduit from the pump to your heart is rubbing on the already irritable left ventricle. And every time you take a deep breath or lean forward, it irritates it and you go into VTAC." He said, "This isn't good." I said, "Yeah." He said, "I can probably redo this surgery in another couple of weeks when you're stronger. Or I can petition the transplant board to give you 1A status for 30 days because this is considered a failure of the LVAD." I said, "Thank you, Jesus."
So what's 1A status?
That's the highest status in that region. That means if a heart becomes available, I get the first dibs at it.
So you're the top priority.
Yeah.
You're the top priority.
And
So he petitions to do that for you.
yeah, there's something called UOS. I don't remember what it stands for, but it's the Universal Organ Service something. There's maybe 10 or 11 regions in this country for transplants. And so
That's it.
Yeah.
For heart transplants,
Yeah.
only 10 or 11 regions.
Yeah. And so I left Tennessee, which is in one region, to go to Birmingham in another region. Turns out I got a heart from Tennessee because I was so high priority. But I found out that because of him petitioning the transplant board and giving me 1A status, I would have 30 days of high priority. I got the call on the 29th day.
So just to kind of go back, because I'm not familiar with this. So that doctor petitions to a transplant board. So this is like a board of physicians and administrators, and they're making that decision on whether or not approval is done. Because I guess getting a heart is rare.
Well,
somewhat rare.
Somewhat rare. I can't tell you how many people are on that board, but it's not a simple decision of the cardiovascular team at one hospital making the decision.
Yeah, it's
many other folks that meet and decide on your behalf. And in this case, that was a really, really, really big deal.
Well, what happens though? So 30 days, you're on the high priority list. After 30 days, what would have happened? You'd have been back on the low list again?
Yeah. Actually, my wife found a place where she could check the status of where I was. And the day after I got my heart, I would have been 67th on the list.
So just backing up. So you're at UAB. You're on the list for 30 days. What does that look like? So you're admitted there. You live there.
No. Once they gave me the pump and get the batteries and tuned me up enough,
okay,
they said you can leave. You need to stay close by. You need to stay within 2 hours of this center at all times in case we get a heart. There's a sort of an unwritten rule that if it's the heart can only be outside the body for 4 hours when you get a transplant, you've got to be within 2 hours of the transplant center. They're making some improvements on that duration now, but back then it was 2 hours. And so we stayed at a place called UAB Towers. There was floors of this high-rise condo there in the medical center that were subsidized by some hospitals, by some local churches, and renovated a really old townhouse. It was a reasonable place to stay right in the medical center.
And these are all mostly patients.
These are a lot of these patients are patients who've just had surgery or who are waiting for another procedure, who are too sick to go home.
And so you and your wife were staying there for 30 days and just waiting.
Just waiting.
Waiting. What does that look like?
Well, it's a difficult time. They're saying you got to get stronger. You got to eat more, get stronger. I had a condition by that time called, before I got the VAD, it was called cardiac cachexia. That means because of your weakened heart and inadequate pumping, you were starving to death. I had dropped down to 132 pounds.
So the blood has such low perfusion. Of course, blood brings nutrients, and so you're not getting good perfusion really anywhere.
No, and it shunts away from the less vital parts, the gut. The gut is less vital than
the kidneys and the brain. And
so I was getting really poor blood flow there, and I was weak and had to get stronger. So
how much did you weigh then?
I was down to 132.
132 pounds.
Yeah, the least I've weighed my whole adult life. So I was trying to get stronger. They were going to send me to cardiac rehab, and in retrospect, I saw what was going on, that when I would exercise, I'd have bouts of VTAC and scare them. And so they really didn't want me there in cardiac rehab, and they kept making excuses for scheduling me. So it turned out that I did my own exercising at Walmart. I would get my bag with my backup batteries and my extra computer console. It was like an airline bag. I went everywhere with it. I'd throw it in a cart at Walmart and just walk around the periphery of the Walmart store over and over and over.
So you were the 55-year-old just walking in Walmart.
Yep.
With your wife beside you.
Yeah. My sister was there part of the time when my wife got to go back home to check on my youngest son.
Trying to get stronger.
And nobody paid any attention to me at Walmart. It was no big deal for this guy to be walking around with what could be, a computer and bombs attached to him for all we know. But it was no big deal to them. So I exercised at Walmart every other day and was getting stronger and waiting for that call.
So you were getting stronger though?
Yeah, I was.
And were you eating and gaining more weight?
Yeah.
Okay.
Yeah, it was good. I actually, one of our favorite places to eat was the hospital cafeteria. We'd walk across the street and they had soup and cornbread and things like that.
So was your sister the one there with you most of the time?
About half the time.
Okay.
My wife was trying to figure out how to close my practice and take care of my son David at the same time.
He was a senior.
Yeah.
So your son was back at home, worried about dad, trying to get through senior year, which had to be tough, while dad's in the hospital waiting for a transplant.
Right. One of the neatest parts of that whole time down there, I basically got to attend my own funeral. There was a social media platform back then called Care Pages. I guess there's some others called Caring Bridge and stuff like that. But you can imagine if someone goes away to a medical center and they have a support system that's left behind, the support system is constantly calling the patient's wife, trying to find out what's going on, what they can do. We're praying for you. Well, with this Care Pages, my wife would post something every day of what was going on with me. And then my patients, friends, family, church would all respond. And some would respond publicly, some would respond privately. And the private responses were amazing. That's what it was like to attend your own funeral, because everybody thought I wasn't going to make it, and they wanted to tell me, remember that time that you said such and such, or remember that time that you prayed with me, remember that time such and such happened. All those memories were amazing. And
that probably got you through a lot.
It did. It did.
So So
It was a special time.
so that 30 days as you thought you were dying or may not make it, friends and family and people that had meant a lot to you throughout your life were writing you messages and telling, it had to be encouraging.
It was amazing.
But they were all writing as if this may be their last message to you.
Yeah. It was, there's some things that you really can't explain how they sustain you. But yeah, you say, hey, I made a difference. And some of those things that you realized it meant so much to the patients, I didn't remember. It was no big deal. Those times when they said stuff like, I remember that time you prayed with me, I remembered those, just about every one. That tells me I didn't pray enough with my patients if I remembered every time. That's another regret.
You can pray with them now.
Oh, yeah. Yeah. Second chances are wonderful. So I got this call on a Saturday morning. That's where I was starting to go a minute ago, telling you about the LVAD and everything. When I got the call, they said, we usually don't tell you this, but since you're a physician, you understand, this is a multi-organ donor, and the heart, of course, is the last organ retrieved, so you got more than just 2 hours. But why don't you head on over to the ACT room?
What's that stand for?
Acute cardiothoracic. Now, when I had been in the hospital and got my LVAD and rehabbed and got stronger, I would walk the corridors around the ICU alone eventually. First, with nurses holding on to all the different IVs and stuff. We passed a room with said ACT, and I saw lazy boys in there, and then occasionally saw people in there hugging and crying and stuff. And I said, what is going on? And I asked the nurse about it. She said, well, ACT stands for acute cardiothoracic. Every now and then, that's where we bring in a patient who just had a transplant and we need to tweak something or check him out. But most of the time, that's the room we call people to when there's a heart. I said, what do you mean? They said, at the moment a heart is available, we try to give it to the most appropriate candidate, the one who's got the best tissue match, the best kidney function, the best everything that matches for that to be a successful transplant. I said, you mean you calling a bunch of people and some of them get told, nope? She said, right. The one person that everything matches best with gets the heart and the others go home. I said, wow.
So they all come to the room and only one gets the heart out of that room.
Yeah, and others go home.
You think there'd be a better way to do this, right?
Yeah.
I mean,
that's the way they did it then. They may have changed since then. But, without Joshua 1:9, I don't see how you would do it.
So you got called to come to this room?
Got called to come to
Was
the
that
room.
the first time had you ever been called to come to that room before?
No, this was the only call I got the 29th day. So we hurried on down there. It was like a Charlie Brown cartoon. My wife was, like Charlie Brown with Lucy pulling Linus in his security blanket, trolling the breeze. My wife was pulling me. My feet were hardly touching the ground. I had my little bag full of batteries behind me. And we got to the building that has the ACT room in it. It was just a couple blocks from where I was living. And the nurse greeted us and signed us in and checked my blood, drew blood and started an IV and said, I'm so glad it looks like you might get a heart. And just have a seat and we'll be checking other folks in here in a minute. We waited an hour. Another hour started, and I said, what, something's wrong? She said, well, it might be. We pleaded with her to call and see what was happening.
So you knew something was wrong.
We knew there was a problem. We just knew it. So we observed her get on the phone and call and say, I'm calling about the proposed heart transplant here at UAB that was supposed to take place now, and I was trying to find out what happened. We have a candidate here. Oh, I see. Really? Yeah, okay. Well, thanks, and hung up. She turned around and looked at Terry and I, and her tears were in her eyes. And Terry was saying, something happened with the donor, right? There's trouble getting the heart out. Well, what was the story? And I was trying to talk to her, and Terry was talking to her. She just gulped and stood there with tears in her eyes and stood up her hand like she was directing traffic. I said, just a minute, waiting to talk. She said, I don't think this has happened before. This is your heart. No one else is coming. She's answered prayers. Later that day, or later that week, I found out that there were 2 other people on the transplant list, actually higher priority than me because they were pediatric patients, but they couldn't take a 39-year-old's heart. So I did not have a bunch of other people sitting around deciding who got the heart with me. It was my heart. And I also remember that day, one of my surgeons, an Australian, before they took me back into the surgery room, he announced, sort of shouting down the hallway to my wife, "It's a good heart." He had told us that it's not a go on the operation until he declares it's a good heart, because sometimes the heart muscle begins stiffening up when it's outside the body. So it was just like a real special time when David said, it's a good heart, it's a go. So I had the transplant.
So you find out that you're the only one, and then from that day until the transplant, I mean, it happened that day, right? I mean, they do it right then.
Oh yeah, immediately.
And
one of my surgeons actually flew to Memphis to retrieve the heart. You know, he was involved in the retrieval and brought it back.
You know, one of the things that when you were saying this, that I met with a guy today, and you know, he quoted in Galatians 2:20, and it says, I've been crucified with Christ. It's no longer I that live, but Christ that lives in me.
Yes.
The life which I now live in the flesh, I live by faith in the Son of God, who loved me and gave himself for me. And as a Christian, it's important to realize that Jesus Christ gives you a new heart.
Yes.
You know, it's you know, he changes your motives and your purpose and your direction. And he's the master surgeon.
Absolutely.
Because not only did he pay the price of all the sin, but he actually makes you a new person. So this is why, as a Christian, people are changed. They're really changed.
In my case, you know, I accepted Jesus Christ as Lord and Savior when I was 12 years old, but to be absolutely changed, where you truly live for him, with me, it was an event from that time that I got a second chance on life. With most folks, it's more gradual. They more slowly are moving on board instead of saying, okay, I'm all in. I was all in.
So you're all in, you got the transplant. How long till you're able to go home, and what is that? I mean, how does that look like?
Well, there's repeated visits back to, it take a while to get out of the hospital. They tune you up, make sure you're okay. Then they said, we don't want you to leave this area for a while because we're seeing you every 2 weeks for heart casts and transplant and heart casts and biopsies. So they would do a right heart cath every 2 weeks and go in my external jugular, take 5 pieces of my heart and analyze it to make sure I wasn't rejecting. And I had no rejection the whole time. And these visits with the heart cast that measured all the important pressures and stuff and doing the biopsies, they stretched them out every few weeks. I'd had a few of those, and they said, we don't want you to leave Birmingham just yet. But we may let you leave for a special trip. I found out my son, the soccer player in his senior year, was playing in an all-star game. He was a Tennessee all-state. And they had an all-star game in Hendersonville, just 2 hours from Birmingham. And they said, if you go there and come right back, we'll let you do that.
So this is after the transplant.
It's after the transplant.
But you're still a risk. Like you're still not in the clear.
Oh, I'm high risk of infection because I'm on real high doses of immunosuppressive drugs. They said you got to wear a mask the whole time. And if anything goes awry, you got to get right back here. And so I went to this game and stayed away from everybody, sort of stepped behind the bleachers on one side or the other because I was real afraid of catching germs and wearing a mask. My son got a hat trick that day.
Which is 3 goals.
Yeah.
Which is pretty rare.
Really rare. And the guy came up to me and said, this is an amazing day. And I said, you wouldn't believe the story. And I have an aunt who lived in Hendersonville who came to meet me there and check on me. And then Terry and I went back to Birmingham, and I think it was another 2 or 3 weeks before I got to go home. It's an amazing journey.
So, so one of the things with the transplant is, you're still not 100% in the clear. You got to take medicine pretty regularly so your body doesn't reject it.
Oh, that's just part of it. You're on immunosuppressive drugs the rest of your life, and they have consequences. The obvious ones are if they suppress your immune system to avoid rejection, you can have serious infections, and all the weird stuff can happen to you. You have a new set of rules about what's dangerous. Me diving underwater in a lake is no longer allowed because of all the bacteria that could get in my sinuses would wreak havoc, and I would have a fulminating sinus infection. So I didn't get to, there's a lot of things you just don't do anymore. But the immunosuppressor drugs, I knew that was part of the journey. Your risk of skin cancers is tremendously increased. Other cancers, so far on my journey, I've had 7 skin cancers and 2 lung cancers. I've had osteoporosis, kidney damage, neuropathy. It's all just part of the.
But you're here, though.
I'm here, and I've got.
It's been 15 years now.
I've got 2 sons married with wonderful Proverbs 31 wives, and I've got 3 grandchildren, and a chance to do things for my Lord and Savior that I never imagined.
So let's what we're gonna do now is we'll take a little break, and when I get back, I want to talk about DIBS rules,
okay,
and kind of what you're doing now to serve the kingdom.
Okay, thank you.
Hey, we just wanted to thank everybody for viewing the content. If you like anything we're putting out, please subscribe, like, share it, and just thank you for your prayers and support. I wanted just to tell all the guests that the For the Kingdom podcast has 2 main goals. And goal number 1 is to glorify the name of Jesus Christ. When Christ was on the cross, he prayed to the Father that his name would be glorified. And goal number 2 is that his kingdom will expand here on earth like it's in heaven. The Lord taught us how to do that when he taught us the Lord's Prayer. If you have any prayer requests at all, please send them. Please send them to us. Be specific. Give us your name. Tell us what you want to pray about. We're going to put a board back here in the studio, and we're going to commit to praying for you as you commit to praying for us. And finally, we just want to remind everybody that Jesus Christ alone solves humanity's biggest problems, and it's our rebellion against God, and it's the problem with death. So when we commit ourselves to Christ, He gives us a new heart. He pays the penalty for sin, and He promises us eternity in heaven. So thank you, everybody. We appreciate the prayers and support. Please like and subscribe. God bless. So welcome back from the break, Gary. And just wanted to recap the last thing we talked about was you had just had the heart transplant. You're still very high risk, and you're going to see your son's game. You basically missed his whole soccer season. You were in the hospital. And so you're there with the mask on. The doctors like basically signed a waiver saying, yeah, you can go, but be careful. And you're standing there just watching your son play, I guess for the first time in about a year live.
Yeah.
And what was kind of, I mean, what were you thinking then? I mean, were you thinking?
This was a validation from my Lord and Savior that, look, this is why you went through this. I mean, I was there seeing my son get a hat trick at the All-Star game, and I wasn't supposed to live to see him graduate. It was amazing. It was one of those too good to be true moments in life.
And your son did graduate, and he went on to play what, college soccer?
College soccer, and then he was blessed to play semi-pro soccer in England for a year while he worked on an MBA.
That's pretty cool. That's pretty cool.
He had a great experience, and it looks good on his resume.
Yeah,
Get some attention. Yeah.
And so when you were in the hospital, you wrote this thing, which I'm pretty interested in, called DIBS Rules.
Okay.
Well, now first, I don't need, what does DIBS stand for?
DIBS came about back when texting first came about, when you had to push the numbers on your phone repeatedly to get a letter. And I was DIB, Dad in Black.
Dad in Black.
Or sometimes folks called me DIB for Doc in Black, and because I wore black all the time. That's another story. But when I didn't think I was going to make it, I was wondering about my legacy. And I said, I've got two boys that we've got so much unfinished business and things we should have said or recapped. What's going to be my legacy? And we had watched this NCIS show before, Gibbs Rules on NCIS, where he had a certain number of rules of how to do a criminal investigation. And a couple of those applied to life in general. And so my wife and I got this idea of DIBS rules, of something I want to leave to my sons. And number one was, there are no coincidences. And as I probably elaborated when I shared that with you, in the life of a believer, you will see certain things, events, answered prayers, and even miracles that you know is the work of God acting in your life. And even the small things, you say, that didn't just happen. You know, this is not a coincidence. God was involved here. So I started with DIBS rules from that. And then there were some that fit my family, not for everyone, but for my family. Rule number 2 was one I shared from that TV show: always carry a knife and keep it sharp.
Do you have a pocket knife on you now?
2 or 3.
So I always keep a pocket knife.
Yeah, I go a step further.
You got it a step further. Watch out. But I mean, is yours sharp though?
You can shave with it.
You can shave with it.
Yeah.
You can shave with it.
Many years ago, I had helped my best friend move and dulled my knife cutting boxes and stuff. And that was Labor Day weekend. And that Tuesday, I would put my knife back on my belt. And I said, man, that's dull. I'll go sharpen it. And I had one of those high-speed honing wheels to get a razor edge on it. Went out in the garage to do that before I went to work. It caught in the wheel and threw it into my groin. And so I'm standing there with blood pouring out of my groin, and thought, I'm afraid to move. That's sticking right where the femoral artery and nerve are, but I can't leave it there. So I pulled it out and put pressure. I still had feeling, So I laid my knife down and I made a call. My wife had just dropped off my older son at the school he went to. I said, "Can you circle back by here?" And she knew that from my urgency what was going on. Long story short, she took me to UT Hospital, and I knew that the ER doc. He said, "I can't believe what you've done here. Don't move. You don't believe it, but this is your lucky day." And I said, "How could it be my lucky day?" He said, "Mike Freeman, the head of vascular surgery, is just walking through the ER." And he grabbed him and brought him in. And Mike checked my pulses and listened to my story and said, "When did you last eat?" And I said, "Well, I just had coffee." He said, "We're going to look at that in the emergency, up in the OR. I don't even want to look at it down here." So he took me up to the OR and fixed it. And
So you actually hit your femoral artery.
I nicked it, sort of the first tiny little branch there. But the very end of that knife, the blade's that long, went into my hip capsule, so I had to stay overnight for IV fluids. But I had just buried that knife in myself, so I stabbed myself.
Well, I thought this was a little cut. This thing was
serious.
This thing was in there.
Yeah. And from then on, everybody would call me Zorro or say, "Hey, you got a knife?" So yeah, that really hit
Well,
home.
you got all black too. It's like
there you go.
Zorro over here. That's funny. I want to go back to the no coincidences.
Yeah.
And so, some of this is we need to understand that God is outside of time.
Yes.
And He is orchestrating your footsteps. He's orchestrating your life.
Some people couldn't comprehend that, but before the beginning of time, He arranged for you and I to meet and spread His word here today. For me to meet you through our friend at work and travel 4 hours, sit here and get in front of this camera. It's amazing. Our Lord is amazing, isn't He?
Yeah. Well, I think it's cool. You married your high school sweetheart, and I married mine too. And when I hear that, I'm like, man, God definitely put her in my life.
Oh,
and,
no doubt about it. When I talk about my marriage, I have some friends who, I married up, but by saying up, I don't mean I married into a higher social standing or married into money. I married someone who was up, meaning closer to God. She was so much closer to God than me, and she pulled me up, and I'm not nearly as close as she is still, but I'm getting there. But that was truly life altering, marrying the right person.
Well, she was she interceded on your behalf.
Absolutely.
And probably still is.
Mm-hmm. Did we talk about prayer warriors?
Not really. Let's touch on it.
Okay. Well, my wife is one of those folks that people come up to and say, "Terry, would you pray for me about this?" And they know that she is a prayer warrior, someone who has open channels to God because she's talking with Him so much. And those of us who are strong believers know that the intercessory prayer works. And if someone, and numerous people, ask for intercessory prayer, the Lord listens. He does. During my journey, one night I was in in the surgical ICU before I got to heart transplant ICU. And I was on the edge of ICU psychosis. I had listened to all these alarms go off all night and beeping, and I was staying down there an extra 2 days because they're worried about me having this extra fluid in my lungs. And I knew I was just about to lose it. I thought I'm going to have to ask for medication or something. This is ICU psychosis just coming around the bend. And I called out, "Help me, Jesus." And it turned out I really did holler it out because I startled everybody in the ICU, and the nurses came over to me. And a minute or so later, my wife was there, and she said, "It's going to be okay." I just got off care pages, and I found out that the membership of at least 12 churches are praying for you right now. 12 churches. People who ask their churches to pray for me. And starting at that point, I had a different kind of sense of peace, that the peace, as you've read in the scriptures, that surpasses all understanding. It sustained me and got me through the journey. And
Yeah.
I could, when people say thanks for the prayers, I could feel them. I could.
Yeah.
It was great.
Yeah. Prayer is so powerful. I think we don't even begin to understand how powerful it is. One of the things that we do, we record these mostly on Friday,
Mm-hmm.
and you got my text yesterday, so I put this out to all the former guests, just to pray for this. Because I want Jesus Christ to invade this. This is His. This isn't our podcast. This is about Him and about His hand in people's lives and what He can do in individuals. And so, just for the audience, if you're out there and you hear this and you need prayer, we're gonna start putting a prayer list up in here now.
Awesome.
And we'll put this on the board, and we'll start praying for people. Whether it's a heart transplant, drugs, family member, prayer is so powerful, because we really touch in the heart of God.
Absolutely.
And we're asking for the King of Kings to intervene, and He's able to. It wasn't the doctor that healed you. It was Jesus Christ who healed you and gave you a new lease on life.
Absolutely.
And those 12 churches and your wife who sat beside you all those nights crying out to God on your behalf, it did something.
Oh, absolutely. And I was praying, but when you're that sick and your blood pressure's so low, you don't get the good blood flow up.
No.
Where you remember it or you make a lot of sense. You say a few things and sort of drift off, and that's where I was.
I mean, you were so close to death for months.
Really was.
All right, so carry a knife, keep it sharp. You've proven you've done this. All right, so we don't know for YouTube, but I think we're allowed to say carry a firearm. You can't say the other word.
Yeah.
Hey, I'm big into the Second Amendment.
You may need to protect those you love.
Yeah.
You can make a decision whether you would say, I'm fearing for my life and willing to use lethal force because of that. But there's no doubt if you're needing to protect someone you love. So
that's right.
I think most people will be on board with that.
They would. Okay, so I think number 4 is, if you really want to learn something, teach it to others.
That's just something that a dad should tell his kids. If you want to learn something, you will go to a higher level of understanding it if you learn it to a teacher's level. So
what's interesting is my 17-year-old is interested in being a counselor.
Mm-hmm.
Okay. And I told her, I said, when I have ladies that want to come on the show, I said, you're coming with me, like to do the pre-interview. I said, number 1, I'm a married guy. I want to just to be kosher and do everything right. I don't want anybody to perceive something weird. And I said, but number 2, you're going to see how to get people to talk and trust you and open up, and you're going to see how to interview. So she's going to start coming to do this with me, just to kind of see, because part of it is you have to you have to learn that skill. And so I'm going to teach her how to do this too.
Sure. That's great.
Okay, so number 5, which I love this. I think this is probably one of the themes of this whole episode. Before you undertake any major decision in your life, pray about it.
Right. You know, when you realize you can invite the creator of the cosmos into what you're doing just by prayer. It's amazing. And if you have a relationship with him, why wouldn't you want his input into what you're doing and worried about, right?
You don't have to convince me. And these are, Gary's smarter than I, but this is a physician who prays. And so I think it's interesting. There's actually studies out there that demonstrate scientifically that prayer works.
Yes. It's hard to do the traditional ideal medical study with a double-blind crossover study. They actually tried to do that 25 years ago to have a set of patients in coronary care that were prayed for and another set who were not prayed for, and then interview and keep records of their outcome. But the problem is they couldn't have a control group because they couldn't control who was praying. You know, they'd say, "Are you sure no one prayed on your behalf? Then you can get in their study." So
we're gonna test it. We're gonna test it here, June. I was telling Gary we're gonna put something up here, a prayer list. When people send it, we'll put it up here. We'll start praying for individuals. So before you undertake minor decisions, so we had major decisions, pray about them, even the little things.
You know, if we use prayer wrong,
Yeah.
we use it. You were talking outside about this heroic thing you did, saving a guy's leg with a tourniquet after a motorcycle accident. You know, we're taught in first aid a tourniquet is to be used as a last resort. You know, did you teach first aid? Probably did, like most medical people.
Yeah. Now, of course, the Army's changed some of their policies. You know, when you the number one cause of death is probably bleeding. And there used to be a lot of questions, you know, with the guy had a tourniquet on, when would you start to get other cell death because of tourniquet?
Sure.
And now they're like, it's, you know, the risk is worth it. You got to stop bleeding. But I see where you're going.
Well,
prayer should be the first.
Instead of the last resort, it should be the first thing.
Yeah.
You know? And, you know, in so many medical scenarios, you get to the point and say, okay, well, things aren't going well. We need to pray about this. Well, couldn't we have prayed early on when we were just beginning treatment before we thought we were losing them, you know? We need to pray early on and not use it like the last resort. And I think so many of us physicians are guilty of that, of saying, oh, well, I got the simple nuts and bolts of treating this straight. Let's do all this. And if it fails, then we'll ask for a divine intervention. I think you've got a relationship with him. You ask him to intervene now. Say, I got an easy one for you, God, you know?
So, Gary, you're calling out all the physicians and providers to start praying for their patients.
Well,
I agree with you.
I failed mine many times. This is something that I was going to share in my book one day, but I have something called warm fuzzies. And if you say warm fuzzy, you picture a child holding a stuffed animal against his face.
Yeah,
or something like
this
that.
is an Army term too,
Yeah.
warm and fuzzy.
Yeah, but this is something different though. But this is something that gives you the warm fuzzy feeling. And I had a warm fuzzy drawer of cards, mementos, thank you notes and stuff from my patients over the years. When they would give me something and say thank you, and I had a drawer of that. And gosh, after my wife closed her practice, when I was waiting on the heart, it all got just dumped in two shoe boxes. And not long ago, she was going through the stuff in the attic and said, what do you want me to do with these? And I saw my warm fuzzy drawer here in these boxes, and I started reading the cards and reliving it. And say stuff like, thank you so much for what you did during the care of your dad. I can't believe you also listened to me and you stopped by the funeral home afterwards. And, the patients don't realize that we need closure too.
Yeah.
And every death that we didn't prevent, we got to figure out how to go on from there. And sometimes stopping at the funeral home is part of it. But what I was building up to is on some of these notes, not many, unfortunately, they said, thank you for praying with me. And, we have these memories of intervening on our patients' behalf and are given this special opportunity to take care of them and be there during what they would consider sentinel moments in their lives, moments in life they'll forever remember. And we fail them if we don't call in the creator of the cosmos to be part of that moment. They can make such a difference.
Yeah, I agree.
And that's the bit about the warm fuzzy drawer.
The Army warm and fuzzy is similar though. It's it's like what gives you that feeling of that something's going to be successful, that it's going to be done right, that it's good.
Okay.
And I was telling my son I bought this like conversational game, and one of the things was like what's something that you laugh about now that you used to believe in when you were younger. And I was asking my son that. And no joke, my son thought I was Batman until he was about 8 years old. And like for a dad,
What a compliment.
Yeah, I was like,
Yeah.
you know how good that makes me feel? And like, I know it sounds super corny, but like, I mean, I want to be my son's hero. I want
I
to.
think we all do.
Yeah, we all want that. And okay, so all right, we're gonna show respect to your elders. It's a great one. Honor your father and mother.
That's, one of the commandments.
Yeah, it's biblical.
I think when that commandment was left for us believers to follow, I think one of the intentions was when it's so hard to honor them, and that's when they need it the most, when they're old and feeble and struggling with their memory. And we need to show them honor at that time especially.
That's a great one. All right, number 7, you don't need a tattoo to make a statement of who you are. Enough said.
Well, neither of my sons have a tattoo yet that I know of, but when they were coming of age, I said, if you're going to get a tattoo, please make it Jesus or your mom, something that 20 years from now still means the same thing. And this day and age, so many people want their story right there. I get it. That's part of breaking the ice. And no different than me wearing a bracelet or you wearing something. But you don't need that for your identity.
All right. So if you're going to say something that you wouldn't say in front of your mother or daughter, don't. That's a good one. I've actually I apply a lot of these. So walk on the outside.
Now that's an old romantic type thing.
Yeah.
But it shows that you really care. If you're walking with someone you love and you say, I'm going to place me between you and the traffic.
That's a great one.
What it means.
All right. When you're not in control of the situation, take comfort in knowing that you have a personal relationship with the one who is, and he loves you. God is sovereign.
Yeah.
It's hard to do though sometimes.
But when you're going through a difficult time and you say, you possibly can't understand what I'm going through, Lord. And he says, no, wait a minute. Did you read my book? He spent 33 years on this earth and he experienced just about everything we can and the most horrendous death imaginable. So he knows every emotion and feeling we're possibly experiencing. So we can call on him for everything.
When you attend a funeral, wear a tie.
Again, just another thing you tell your boys to show respect. in some cultures, going to a funeral is supposed to be the utmost symbol of, how do I say it? You're showing someone a favor that they cannot ever repay. They'll never get a chance to repay you for going to their funeral. You go to their funeral and show respect and say kind things about them, even if you didn't know the family. You say, well, I just knew him. I didn't know the family. Well, wouldn't the family love to hear what you thought of that guy, what he meant to you, even though you never met his wife? Go and tell him that. Yeah. Yeah.
When you experience this firsthand.
Well, like I said, I sort of got to attend my own funeral when everyone thought I was dying and sent me messages. It was amazing.
All right, so show up. Wherever you are in life, be there for your family, friends, and those you work with. I agree. Just be there. Of course, everybody says, hey, if I have a great friend, they use this example. If I had a friend and I had a tree fall on my house at 2 or 3 in the morning, would that person it's raining, would that person be there? That's a good friend. I still agree with that.
Oh, yeah.
Learn to wait. That's a hard one right there. You had to wait.
Yeah. Oh, yeah. Impatience is basically just saying my time is more important than somebody else's. And the worst wait possible, I've sort of been there when you're waiting on someone to die so that you get a chance to live.
So we're gonna kind of go through the rest of these quick, and you tell me if I need to stop.
No. Okay.
So acknowledge sacrifice. This applies to everyone in your life, coworkers, friends, family, and your Lord and Savior.
That's it.
Pray often and sometimes pray out loud. Each of us has been blessed with prayer warriors in our lives. These are people who openly ask to pray for us in times of need. We recognize them because of their prayer lives. Those who pray often seem to keep an open channel with the Lord. Married couples who pray out loud together have a divorce rate of 1 in 10,000.
That's
wow.
Just I've heard quoted many times, even if it was off a whole decimal point.
That's still
huge.
Be the one person people call when they're in trouble. I like that. Humility trumps pride. It's really better to ask permission than to have to ask for forgiveness. I'm terrible because I'm guilty of that one. I'd rather ask forgiveness. It's terrible. Give back. Return things you borrowed cleaner or sharper with the full tank. What's so funny is I one time was selling a house and I borrowed a friend's pole saw, a chainsaw, and a weed whacker, and I broke all of them. He's still my friend.
Really?
It was terrible. Get it right the first time. Did he ever loan
you anything again?
Yes, he did.
Okay. Well,
he is a good man. His name's David, and he's a great friend of mine. They make a tool for that. I agree. Nothing good ever happens after midnight. I agree with that too.
There's 5 in a row there that actually came from my father-in-law, and that was one of his sayings.
Your father-in-law was Paw Tate then?
Yeah.
Okay. The cheapest thing you can do is pay attention.
His words again.
That's pretty wise right there. Measure twice, cut once.
There's an old adage, but we forget
especially when you're working with wood or anything. Never be unreachable. And then no explanation. There's several no explanation. Sometimes you should walk away. I agree. Sometimes you're wrong. Sometimes real men cry. Sometimes a hug is all you need to say. Yeah, I love that. All right, so Gary, let's wrap up the interview. Let's talk about really what you're doing now, and with Under the Bridge, what you're doing now with the school.
Okay. Well, I when I got this second chance in my life, a chance to see my family grow and develop a relationship with Lord and Savior, I thought that's the icing on the cake. One of my proudest dad moments was my second year attending Bible study fellowship. Both of my boys were available to attend that with me. And both sons studying the Bible with their dad on a weekly basis, which is amazing. But other things have happened that just are uncanny in the way they fell into place. For some reason, the Lord gave me a heart for the homeless. One of the jobs that I was given was to take care of patients at the psychiatric hospital in Knoxville. They need a medical evaluation when they're admitted, and then medical consults sometimes. And a large number of these folks were homeless. The rest of them are either psychotic off their medicines, or substance abusers, or combinations of those. And a large number of them are homeless, and they respond so well to just showing them some kindness and respect. They're not used to getting that. And then with our job at the PA program that I'm a medical director for, we had this opportunity to serve the homeless literally under the bridge. In downtown Knoxville, there's a space probably as big as 2 to 3 football fields where there's a viaduct, 30, 40 feet above, where there used to be a homeless camp, and now it's an open area they keep clean. And every Wednesday night, the Knoxville Dream Center offers meals for them, and they offer a dental trailer there, I think once a month. Every Wednesday, we're there to offer first aid or medical care. It's amazing to treat this population and hear their stories and see how we can help. My church is at the south end of downtown Knoxville, and we have a large homeless ministry that my wife and I are very involved in. And sometimes we feed over 100 folks hamburgers and hot dogs right off the grill. And they named it Care First, and it was so cool that one of the first months we were doing it, one of the guests came up and said, "That's a cool name, because you all give us first and everybody else wants to give us seconds, or the leftovers." I thought, well, they noticed that we're giving them something special, just like biblical first fruits, So I don't know the donor at all of my heart. Something slipped about the retrieval took place in Memphis, and I heard the age of the heart was 39. That's why I know I'm 54 on the inside here. But I know nothing else about the donor. But knowing the Lord like I do, I wouldn't be surprised at all to find out that my donor was a homeless person, and he gave me a heart for dealing with the homeless. And I have folks ask me, since I had a transplant, how life is different. Hey, do you like something? You like broccoli now and you didn't used to? Or you have a taste for this or that you didn't? And I guess, to be honest, I'm very open-minded now to explore most anything, because that's the way I see if the Lord is directing me that way. It's not what happened in the past. It's what does the Lord want me to do at this time in my life, whether it's as simple as what food I'm eating. But I have a little answer for most of that that's sort of tongue-in-cheek when I say, well, I don't know anything about my donor, but for some reason my shoes and belt and handbag have to match.
And that's a new thing for you.
Yeah.
He's got some pretty fancy shoes over here today.
Nah, these are just clogs I've worn since I was an intern.
But well, Gary, I think after today's episode, it's just awesome to see what God has brought you through, what He's doing now. We really covered just the power of prayer, and so I encourage the audience, put your faith in Jesus Christ. Really start to add this discipline in your life. It will change you, and it will move mountains.
Absolutely.
And so thank you for talking about your wife, Terry, and thank you for what you're doing now.
My pleasure. My pleasure. Thanks for this opportunity.
Gary, thank you.
Sure.
Appreciate it.
Tell them hope isn't far away. There's new life in Jesus.